Okay. Let's see. All right. Got all commissioners on now. It's 11:36. Good morning, May 20th. We are recording this meeting. We've scheduled a town hall to communicate out to businesses specifically, but anybody else, of course, joining that might have questions are welcome, absolutely. And we've got our Public Health Director, Colleen Nielsen here, our emergency manager, Kaylee Ham on the line, as well as commissioners and environmental health, Jackie Littlepage. We're here to give an update on movement from the state and then what we'll look at locally as far as COVID protocols. I apologize. You can't see my screen if it's this way, but you can't see me if I point it up to the ceiling. So bear with me. And so with that, I'll ask if my fellow commissioners have any other comments, but I suspect Colleen is ready to kind of give us an overview and an update.
Thanks, Sarah. This is Commissioner Marcella. I don't have any other updates for anyone. Just wanted to say thank you for taking time to be here with us today on such short notice. We do appreciate it.
All right.
Hi guys, thank you so much. This is Colleen Nielsen, Director of Lake County Public Health Agency. As promised from our last press release and our last public health order, we've sat down with the Board of County Commissioners and some other folks, including the mayor, in the sense of what do we do with our public health order? Currently, as you know, the CDC as well as the state is not requiring masks for folks that are fully vaccinated. Currently, here in Lake County, our mask mandate is more strict. We are still requiring masking regardless of your vaccination status, both indoors as well as outside if you cannot maintain 6 feet. We know that this is a really effective measure at this point in time at decreasing transmission of COVID. We recognize that a lot of our surrounding counties just this past week aligned with the state as well as pulled all public health orders back in the sense of other than what's happening at the state and or federal level is what folks need to follow. We are looking to continue our public health order until June 1st. So that would include masking through June 1st. Our vaccination rates are about 49.7% of folks are fully vaccinated. So we're halfway there, but that still doesn't give us, great numbers as we continue to vaccinate people and as we continue to test and quarantine and isolate folks. It's important to still continue to mask at this point in time. Like we recognize that as soon as we take that mandatory line with the state, it's going to be hard investigations and anyone who tests positive. At any given time, we have about 10 folks that are positive in our community that we're aware of. I feel like we're a little bit where we started in the sense of those who are symptomatic are not necessarily always getting tested. The folks that are getting tested continue to show positivity. It's still showing that it's kind of working through social groups at this point in time, which also is a little tricky as more folks are socializing and or, going out to more businesses. We're just trying to, like I said, decrease transmission and make sure that we're in a really good spot. We know every week that we continue with the mask order is a week that keeps us in a better position. Also, that is what is happening currently. Obviously, once this happens come June 1st, businesses are more than happy to operate how they want in the sense that, hey, we know that vaccinated folks don't have to wear a mask indoors. We want to keep that up because I recognize too that it's very hard when folks, whether or not they're vaccinated or not, to have to ask that question and or, are really going to get honest answers. We continue to be with the honor system from the beginning, as you know, as far as enforcement, but we want to make sure that if there's opportunity for conversation and support in the next 2 weeks to make sure that businesses are getting what they receive as we move into this next phase come June 1st. There's also opportunity if we think that to increase our vaccination rates. Is anyone aware of like anything that they might are thinking like as far as incentives? I don't know that we're there yet. I feel like we're kind of just steadily working our way through. As some of you may be aware, 12 and up was just eligible for vaccine as of the 12th of May. We continue to encourage folks to get their children vaccinated as well, as we know it's all a piece in the puzzle, especially around school. So that is where I'll stop at this point in time, answer questions, and go from there.
Thanks, Colleen. Does anyone have questions for clarification from Colleen, or any comments, suggestions? Marla, you're unmuting. Go ahead, Marla.
I've never done two Zooms on two computers. I have a Zoom over here for Main Street and a Zoom on this computer, which is like freaky. But Colleen, we've had 4 businesses reach out to us with how to enforce. And, you know, my comment was politely ask them, you know, if you can't put a sign up to say, have you got your shots? Show me your card, kind of thing. But, you know, politely ask if they've gotten their shots, and it is on the honor system. But they're just wondering how if as a business owner, do they do their own enforcement?
Yeah, great question, Marla. So right now, every business has the ability to say, here in Lake County, we still have a mask mandate that's requiring people to wear masks inside. And so that's an easy, right? And people are like, oh, and I think, the messaging continues to come down from the state for people to be aware of things can be different in local communities versus what the state's saying, because we do have the ability to be more strict. I think that question comes into play come, June 1st, when we do lift and we align with the state. And then it becomes, the best protection, obviously, is, that distancing and, masking. And I don't know the answer to that in the sense of, are you comfortable asking? Do you feel that everyone, it's hard to gauge in the sense of if everyone's coming in unmasked? Obviously in restaurants, folks literally are masking and sitting down and taking their mask off prior to even order, prior to, receiving food. I think folks have gotten, more lax in that environment, and just is, and that is not the restaurant's fault. I just think that's where folks are at. So I think it becomes, the strategy of how do we best protect our, staff and our, families. And so that goes back to, is staff vaccinated? Is there opportunity for public health to come in and vaccinate staff, which we're more than happy to do, to go door to door. If, if there are a couple of businesses who are like, hey, we've got 10 plus employees that want to do this on this day at this time at, our business, or these two, we will literally come to you with, 10 shots and do that. So there's opportunity there to protect. I think the enforcement piece has been the same from the beginning, in the sense of, are you comfortable asking, and, or are you just recognizing that it truly is the honor system? And, as always, we talk about not wanting to have people feel, employees specifically feeling like they're getting, or somebody's getting confrontational with them, versus we just have to accept if they're coming in without a mask that they are vaccinated. But like I said, once again, I'm not the expert on this. You guys continue to be on the front lines doing all of this, work with the public in the scheme of it all. So, I'm open to any, feedback and comments or things that, you might want to see. And like I said, and you can continue as a business to require masks, and that's signage, and we can help provide that and support you in that respect.
Until anyone else might interrupt, Colleen, I thought in one of our conversations, it was worth noting and interesting, like you did say earlier in this meeting, the statistics include those ages now 12 and up. Before that, the adults, if I get that right, yeah, the adult statistics on vaccination rates, we were up in 58, I believe, +%, and now including that additional piece of the population. Of course, that denominator is larger, and so we need to work with all ages from 12 and up currently. I'm wondering if there are any other questions, Marla, that you have fielded, or if there are other aspects, even the very smallest thing, or questions perhaps for Marla and or Colleen, from folks on the line right now.
I haven't had any additional questions from the businesses. They just, they're trying to get prepared with the summer.
Yeah.
And specifically having the concern of employees, as we all know, everyone has a jobs wanted sign or posted on so many different websites. So I love the idea of, going maybe door to door and saying, hey, your new employees can get a shot, blah, 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 that we can have some opportunities to help them that way. They're just trying to figure out, we're getting all this information. Like when the pandemic started, it was coming up this way. Now it's coming back down. And, what's going to happen in June? When do we align with the state? That sort of thing. There's a lot of businesses on here. They might have some thought processes too that they could jump in.
Yeah, I think we'd love to hear it, and exactly why we're hosting the meeting here. Absolutely. Colleen, any other questions maybe coming through your office, either from staff or folks working and holding point of dispensing or clinics that you can think of?
We haven't had any requests, but that's why I wanted to make sure that I put it out here for businesses specifically, but we are open to it. I think it's, it's just a planning thing. Like we don't have the ability to just walk the avenue and say you want a vaccine, so to speak. But if there's businesses who are like, hey, we've got a couple of folks, so we can do that, discreetly in, an establishment, we're more than happy, to do that, so to speak. Unless they're like, no, just sit up on Main Street and we'll just send people down the block, like, and, on Harrison, and like, if that's what we need to do, that's what we need to do. But, at the same time, I think, for business planning around, knowing that for most folks, side effects, do occur with a vaccine. So it's not like, hey, I want to get vaccinated from, at the beginning of my shift and then I'm not feeling great a couple hours in, kind of thing. So it'd be more of like a timing thing, so to speak.
What is the
if that's what folks want to do?
Yep. What would be the turnaround or your ability to respond if someone asks for, 1, 2, 3, 10 vaccinations? Could you make it down to a place of business in the same day?
We have full nursing staff on Tuesday, Wednesday, Thursday. So if somebody asks us on a Tuesday, we can mobilize very easily on a Wednesday. It would be less than like a 24-hour turnaround. We still know there's open appointments for vaccine, at, Rocky Mountain Family Practice, as well as Safeway. Safeway does have the Pfizer vaccine, which is licensed for 12 and up. We do have a point of dispensing coming up. Summit Community Care Clinic is coming up on Sunday, May 23rd at Mountain View Community Manufactured Home Community, and that's open to the public. And so there'll be more messaging around that, but that is available here in 3 days if folks have that ability, and it's going to run from 10 to 2. So it gives folks opportunity to get there as well and bring your kids. So that's like the last big point of dispensing we have at this point in time. And then we do have a clinic scheduled at our public health on Thursday, June 3rd, that still has spots open for anyone who wants to get vaccinated as well. So that's just a phone call to public health. It's 719-486-2413. There's a link that folks have to sign up for those. And if I'm faster, if Kaylee, you're faster, if you can drop that link for the June 2nd, or excuse me, June 3rd. Well, actually, is it June 2nd? No, I gotta look. Sorry, I get my dates mixed up and my numbers mixed up. And
second is a Wednesday.
It's the
I still
second on the link, and it's in the chat for everyone.
Thank you. So yes, I apologize to the Lake County Public Health Agency on June 2nd, Thursday. If you sign up via a link, then we can get folks in that day. But like I said, there's still appointments available, but at the same time, if it's easier for us to come to you, we will do that. Even if it's just a couple of vaccines.
Hey, Colleen, I just have a quick question. Have there been any reported side effects from the adolescents 12 to 16 that have been newly eligible to receive the Pfizer vaccine? Have they seen any side effects like they've seen in other individuals?
So when they did the trials, so Pfizer specifically is what we're talking about. So when they did the trials, the side effects from that population, so from 12 to 18, was similar to that of the adult population. And so the most common side effects are, fever, a headache, some chills, that kind of thing. But kids, from what we see just anecdotally, I do not have data on that from locally, from just hearing from families saying it hasn't been bad. Obviously, there's soreness at the site, but so far, and that's the first shot, and we do know for most folks, there's a heightened reaction after the second shot. So it is no different than what we've seen, across our community at this point in time.
Thanks, Colleen. I think also just for the business community to know, if you do plan on continuing with an individual private mask date within your establishment and need some assistance with signage around requiring mask wearing in your establishment, that's something that we have the ability to help with. We would be happy to print out a sign and laminate it for you to put up for your establishment. So if that's something that we can be of assistance to you with, please connect with Marla and she can let us know and we can print that out for you as well. So we've also been trying really hard to make sure that when we're communicating out these public health orders, that we are reminding people that a business establishment has the right to ask about your vaccine. A business establishment has the right to ask you to put on a mask. So just respect the owners of those establishments and respect that they're trying to keep their staff safe that have worked through the pandemic and do your part. So if you need assistance with some of that messaging, we'd be happy to help with that too.
Does anyone have questions they want to throw in the chat? Please, yeah, now's the time to get any questions answered for you.
Colleen, I see a question in the chat from Charlotte about continuing with temperature screenings.
And so from the beginning, temperature screening was recommended. It's never been a full requirement. And so if that's something that you're comfortable with, we find that symptom checking is just as effective. So if it's something like, hey, I want to, drop the temperature, but I want to make sure that folks are, self-screening themselves at home, they have the ability to do that in the sense of, basically the key questions are, have you had a fever? Are you, do you have a cough? Do you have a runny nose? Do you have a sore throat? And some of those things that they've been doing for a long time. And so that is an effective strategy to continue. Like we said, we as public health, we continue to tell folks like, hey, you've got a runny nose or any of those symptoms, like, please go get tested. It can still be COVID. Like I said, COVID is still here. We're seeing it continuing across the state. There's been, obviously a downward trend as more folks get vaccinated. There's actually a great correlation of as more folks get vaccinated, less folks, there are less infections as well as less hospitalizations. And so, that is, like I said, one piece of the puzzle, one effective strategy, as well as, testing and staying home when you're sick. So.
I think I'm just gonna sit for a minute and see if anything comes to anybody.
I had a question for businesses I'd be very curious on. I mean, so, I feel like so much of this has been dumped in your laps as, sort of customer facing businesses. And I'm curious how both, in the past, a concern of mine and ours, I think, is that, your staff and you get put in this like terrible situation with occasionally like, not pleasant customers. And I'm just curious, like how bad has that been for you and your staff? And how concerned are you about that getting worse as people sort of feel like, you know, the green light's just been given from the feds and state guidance? You know, again, I'm not sure what we can do about that, but I'm just curious, like, where that falls on your sort of concern level and how bad that experience has been to date. Again, with, you know, with people not wanting to wear masks and getting, you know, argumentative or even physical about that.
They're not bashful normally, the ones that are on here. So that's what's so weird.
Yeah. Well, or just to say, I mean, that, you know, as we all get our heads around, you know, these next phases of, you know, responsible reopening, you know, and the guidance, you know, I mean, let us know how that's going, and we can think about what to do to, you know, help you all be safe.
Commissioner Fiedler, that's a great question. And I thought some of them would jump in here, the businesses that are on here, but they're being bashful today, I guess. But I know of a couple of times where here on Harrison Avenue, a couple businesses that had some, I'll call them contrarians, or folks that just said, I am not putting a mask on, and they, you know, politely asked them to leave their business, and didn't create a real issue. There was one that was kind of odd that occurred, but most of the people have been pretty compliant with the process. I think Jason put something in the chat box.
Colleen, I don't know if you have the chat open, but it's for anyone on the phone, it's that a lot of folks are already saying that they're fully vaccinated and if they still need to wear a mask and how to answer that.
Yes, and so, you know, at this point in time here in Lake County, we still have a mask mandate in place. So yes, at this point in time, until June 1st, folks are required to continue to wear masks, whether you're vaccinated or not. And something I had gotten a little tidbit the other day, and maybe we'll share that in our press release, in the sense of the CU School of Public Health was talking about, like, you never know where you're going to head or go into a business that may, you know, still want masking. So, you know, just to be the polite thing, right, it's just to have a mask on you at all times in case, like, oh, that business wants a mask, great, you know, I'm ready and I'm prepared, so to speak, to, you know, honor those folks that are, you know, asking me to do that. I kind of like that. We'll figure out how do we pepper that in some of our messaging. And I also, you know, want to recognize too, for the businesses that are here on the phone, you know, obviously the longer we can hold on to masks, the better. But at the same time, if folks feel like, hey, this is an impossible task, it's making it more convoluted, it makes more sense to align with the state sooner, like, I'm open to hear that dialogue as well. Hence why we're here. It's not like, this is what we're doing, you absolutely have to do it, versus like, hey, obviously, you know what I want to do, but at the same time, I want to honor, you know, the folks that truly continue to be on the front lines and are, you know, trying to enforce things, so to speak. So I'm open to hear, you know, any thoughts around that as well.
I think I'll speak up. I think it is confusing right now. And Nancy just jumped on here from her last meeting. Both of us have gone south and north, Salida, Frisco, and it's just drastically different this past weekend. She went one way, I went the other, and we were comparing notes. So it's confusing for our business owners right now. We're kind of in that in-between phase. So, you know, I applaud the, you know, let's phase into this, but, you know, they're hearing all this stuff coming from the state and these are contiguous counties around us. So it's, you know, we're just kind of, they're asking questions and they're being quiet today. I don't get it.
Hi, everyone. This is Nancy from Main Street. And I will chime in. I missed a little bit of the meeting, but in Frisco, I was surprised. And as I was doing recon work, and most of the businesses were telling me specifically, if you've been fully vaccinated, you don't have to wear a mask. And was the consensus in about 10 places that I went to that day. So that's just feedback for you, that's all. And then I don't know what, I think it was the same in Salida for Marla. That's it.
Yeah, no, I can appreciate that. And so I think there's a little confusion. I just opened the chat, and right now, per the state, if you were fully vaccinated, you do not have to wear a mask anymore. But here in Lake County, we still have a local mandate that trumps state because we're more strict and we have the ability. So it's not as if the state is lifting, like the state has said, if you're unvaccinated, then you do have the ability. They were aligning with the CDC. And we have not yet aligned. Our conversation is that we will align come June 1st and accept what the state is saying across the board. And so with that Frisco piece, Summit County and Eagle County just lifted, they just aligned with the state as well. So if you're unvaccinated, you do not need to wear a mask, as well as following all the state mandates, so to speak. And I think the hard part about signage is because it's so temporary, like it's hard to have signs that say, please wear a mask. And then, in 2 weeks, that may not be the case. And because it is convoluted, it's like, if you're vaccinated, then you can do this. If not, there's not really great language. We are trying to figure out a way, per what Sarah put in, about what possibly a message coming into town could be. I still like our logo that we've been using, all the way about responsible reopening and talking about like, we love, Leadville and Lake County community, and possibly, putting in, a tagline there of, beware, be safe, or, be kind. There's lots of things that have kind of come up. We haven't finished off a line. And so if there's somebody who's just like, hey, I think this is really great to tell folks as they come in, but that I think the situation continues to evolve, as we know from the beginning. So it's very hard to just pin it all on one message, so to speak. And so I see someone put in like temporary signs that use what would be a timely message in the sense of like continue to wear masks, or like and I think that's what we struggle with in the sense of hearing the conversation, what do we think would be a timely message right now? Like Lake County mask mandate, mask still required, like that at this point in time?
Yeah, Colleen, I think really what we're asking is just, or what is being asked is like to use those messaging boards from Public Works over Memorial Day weekend, potentially, just to put at the gateway at the north and the south, just saying, local mask order in effect or something like that, something to that effect.
Yeah.
So that people know.
Yeah, that makes sense. Like what I'm hearing, and I see somebody put in the chat, mask mandate in Lake County through May 31st. And Sarah, we are not planning on going. I feel like we're even pushing it right now, trying to get through to June 1st. But, and so we would look to align with the state at June 1st. That is our message at this point. And it's 2 weeks away.
Does anybody have any questions for us? Or comments, or need any resources or anything? We'd love to have an opportunity to continue to have this open conversation. So anything you feel like you might need would be great.
Colleen, do you see the question that just popped up? Okay.
Yes, and so we'll follow up on that conversation of, do all of our public health orders go away at this point in time, and we're truly back to, business with, according to whatever the state says. The tricky piece is, and this is a bigger conversation, is the state has requested masking for 11 and up. And from the beginning, Lake County has required 3 and up for masking. And so that is where we might have to continue a local public health order to continue three and up versus full alignment with the state. So I would say stand by on that one.
Colleen, are you referring to being in the school setting or in general?
Nope. So from the beginning, all our public health orders have been 3 and up. And so in our past public health orders, we've called it out in every single place that it said mask mandate in the executive orders, as well as the state public health orders. And so even in our last public health order, we're still at 3 and up. And if we're fully to align with the state come June 1st, then it would be 11 and up. And so like I said, that can be a conversation.
Yep, and then, but to further align in other regards to the state as far as 11 and up, not having a mask mandate, are you saying that when we align and to lift that, the mask mandate? I'm sorry, I'm trying to clarify.
So currently,
Any confusion that might
the state,
from,
it does not. Yeah, currently in the state, it calls out correctional institutions, long-term care, as well as schools to continue with masking. So they're not exempt. So once it aligns with the state, the state order specifically calls out like schools are continued to, wear masks, et cetera, regardless of vaccination status.
thank you.
For the kiddos.
Colleen, at this point, we don't
And
know.
as we know, that can change.
Yeah, and we don't know if that will continue into the school year in the fall or not at this point, correct, Colleen?
We do not. We have asked the state specifically of like, hey, it would really be great to have that guidance moving into the next school year, because everyone is trying to anticipate what that might look like. I will share that for this year, regardless of what the state comes out with, the school district feels confident that they want to continue exactly how they're continuing. They don't want to make any changes or make it even more confusing in a very confusing year. So they will continue to operate, as is from now until the end of the school year, regardless of what comes out in the next weeks or so. But we do not have information of operation moving into next fall.
Allowing a couple moments here. If anybody has any lingering curiosities, doesn't seem like it. All right. So, and nobody has any comments on Colleen's question about moving into alignment any sooner, and whether that and what your opinion or perspective is on that before June 1st.
I'll jump in. I mean, I do think it's going to create confusion, but it's just 2 weeks.
And as always, like I always say, do your best. I know we're putting these things and it's been confusing for the beginning. That has not changed. I appreciate everyone for continuing to plod along, and we, like I said, do your best. No need for confrontations. Protect your staff and yourselves. Let us know how we can help. And then I think our takeaway is we'll work with Road and Bridge to make sure that we have exactly. Sarah just took the words right out of my mouth. That we'll get those type of signs out now. And so I think we can come up with that pretty quickly.
And I think the mantra is do our best.
Mm-hmm.
Always. Mm-hmm. And give people grace.
All right.
Including yourself.
Is there, I mean, it doesn't seem like there's any other questions for public health at the moment. If nobody has any further discussion, I think we'll look to wrap up and adjourn. Thanks for joining this afternoon. Please, as always, encourage folks to reach out, give any one of us a phone call to ask questions and or direct you to the right folks who can give you the resources you might be looking for. Kayla, is that a hand up or a high five?
It's a hand up, sorry.
Is that a raised hand? Okay.
I was going to ask Colleen and the public health staff if they could pass or distribute rather a press release regarding this information to the business community, just listing those bullet points of here's the date for alignment, here's where we are aligned with the state, here's where we're different, where it's like, you know, the ages of 3 and up, not 11 and up for the mask order. So if you could just maybe do just a couple quick bullet points and send that out to maybe Marla, and we can get that distributed to the business community. I think that would be really helpful for them to see something tangible as well. And then if we can include our contact information on there so that if anyone has any questions or comments or concerns, that they're welcome to contact us as the commissioners, maybe Marla as a resource, and Colleen's general office line as a resource. I think that'd be really great too.
Yeah, Marla, would you put your office number in the chat as well for folks? And then thank you, Commissioner Marcella. Ron and Jen, I saw a virtual reaction up there as well. I should ask you the same question. Was that an attempt at raising a hand to ask a question, or was that just a quick reaction?
Just a thank you for your time and what we've gone over.
Thanks. Okay. Appreciate that. All right. Well, thank you. Thank you for joining us. I hope you know how to reach us. And I think at 12:13 then. Thanks, John. We'll adjourn. Much appreciated. Thank you, Colleen. Thank you, Kaylee. Thanks, everyone. Thanks, Marla.